ABUS stands for Automated Breast Ultrasound. It's a 3D volumetric image of the breast, which is very helpful to use for dense tissue. Patients with dense tissue are at a disadvantage with mammography because cancers can be masked by that dense tissue, and adding ultrasound to their screening mammogram can help us find cancers which we would not have otherwise found. There's an increased rate of detection by 35% using screening ultrasound. The ABUS is different than traditional ultrasound in that it takes a large paddle and obtains 3D images. The traditional ultrasound is a way to look at focused abnormalities of the breast or palpable problems, but it's really not a very good way to look at the entire breast for screening. Patients that are a good candidate for the ABUS are those that have dense tissue on mammography and have a normal sized breast, meaning not something that would take multiple sections to cover. Those kind of patients are probably better served by a handheld ultrasound. We know that dense tissue is something determined not by palpation, it is something determined by the mammogram. About 30 to 40% of patients having mammograms have dense tissue, and this is a problem because it can hide cancers. The ABUS provides us a way to perform screening ultrasound for these patients with dense tissue, whereas before, handheld methods are awkward and time-consuming. Here's an image of the breast with the nipple marked, and we scan through the breast in a coronal plane, and you can see through the tissue. And here we have marked a mass which was not visualized on the mammogram.